Dr. Bindu Balani, welcome again to ITV Gold. Thank you so much for giving us your time today.
Thank you so much for having me again. It's wonderful to come back again and talk to you.
Yes, I think it's important that we keep on raising awareness about COVID-19 and the people should know what's going on. So let's go right into it, Doctor. My first question to you has to be about the biggest news coming in today. The FDA, the Food and Drug Administration, has given emergency use authorization for the COVID-19 booster dose by Pfizer. They're saying that they're authorizing this for emergency use again for people 65 and above, individuals at high risk, and people whose jobs put them at high risk. My question to you is, what do you have to say about this new emergency use authorization that we're seeing, and how important do you think it is for us to right now go into this booster dose?
So I think it's looking at all the data that has come out from Israel and even from U.S. studies. Definitely, we see a slight decline in the efficacy of the vaccine after we cross the 6 to 8 month mark. So I think it's important to be able to boost your immune response up again to be able to fight this infection, to keep you out of the hospitals. The good news is that the drop in the efficacy was not related to immune escape, meaning it is not that the virus was changing and the vaccine wasn't working against you. It was because of the waning immunity, which you can boost by protecting yourself by getting the third shot. So I think by taking the third vaccine, we are increasing our immune levels to be able to prevent this infection from causing us to get severe disease and hospitalizations.
Let me ask you this. How at risk are these individuals that I just mentioned to you today? Because, some of them did get their vaccine, their second dose in, 6 months ago, some even more than that. How are they looking like for you?
So I think that is the reason why having the high-risk population get vaccinated at this point is going to be very, very important. These subjects and these people who had been vaccinated dating back from the end of December, which is basically the frontline workers, and then subsequently the high-risk individual between the month of January end to March, are the ones who are now having 6 months plus time frame that has already elapsed, causing them to have a drop in the dose. Now, these patients are the ones who are going to have, if they get COVID, have more severe disease. So the rate of death, when we knew from the first pandemic round and even again from March of this year, that these are the high group individuals who are the ones who are going to have more morbidity and more severe illnesses in their stay, and if they get this infection again, knowing that Delta virus is the main virus that is floating around, which is very infectious, I think keeping your immune status as good as possible is going to be the key in trying to keep them safe and healthy.
Yes, the CDC today is debating on how to allocate these booster doses and who should get them first. What do you think they should do? What is a good way to allocate these booster shots so that we don't have the issues we did when the initial vaccinations came out?
So I think the good news is that it is pretty much in line with what we did the first phase, right? So in the first two phases were the high-risk people who are currently also recommended to get the booster vaccines. So I think by just following the time that when you first got it, making sure that you're 8 months out, 6 months out from first receive the dose, is going to pretty much put you in the same time frame. So I think we have, especially when we go back to the same vaccinating site, it actually helps because then we know exactly when they came in, and then you kind of, by calendar, you know when the next rotation is going to be. So if we can kind of follow the same guidelines as we did in December, January, and February, I think we should be fine, because it's not that even then we didn't, inoculate the young kids at that particular time. So those who are coming in time with their vaccination status, I think by looking at the CDC card, by looking at when they got the last dose and kind of counting your days out, I think 8 months out, you should be able to pretty much get it and not have that bottlenecking that we did the first time.
Right. Are you currently perhaps worried about this age range of people and also these people at high risk, or people that are in the healthcare? Are you personally worried about them, or do you think we are getting the booster dose at the right time?
So I think I'm not saying I'm worried, but I think I definitely, if somebody asks me, is it time to get the booster? I said, yep, it's time. Get it if you can. So if they're on the right age group and the right patient population who is going to be exposed and at constant risk, I think it's an absolute must for them to pursue and getting it. Am I worried about the fact that they cannot get it in September and they're going to get it in October? No, I don't think so. I think these high-risk individuals who are at risk of getting severe disease are actually very, very good about social distancing and masking. So I think masking still helps. So by the time they get the third booster, if they continue to keep their preventative methods up and safe, I think they will be okay.
Right. Let's now talk about something that's impacting everyone, Doctor, the crisis that we're seeing with the case surging across the nation and the deaths also rising. Alaska has had to impose crisis care standards in all of its hospital systems. Could you explain to our viewers what that means for those hospitals that have to impose those standards, and how does that affect the medical community of those hospitals?
So I think, unfortunately to say that, but I think all of us throughout the US has pretty much gone through the crisis phase in this particular pandemic since it started a year and a half ago now. So we all have kind of gone through what needs to be done, what protocols needs to be in place to be able to manage the overburdened healthcare system when the time hits you. So I think, like, for example, Hackensack, I think we all have our protocols already in place regarding what needs to be done, which floors need to be converted, which units to be used, which beds to be used, what visitation protocols need to be in place, what scheduled surgeries need to be done, what does not need to be done. So again, we all have, over this last year and a half, been able to prepare ourselves very well in case if this, again, surge occurs out of bounds, like how it's happening down south in Alaska, in Alabama and Texas, as well as in the northern western areas in Alaska, etc. So I think being prepared and being very well prepared since the last year is going to keep us afloat.
Right, but some of these hospitals, Doctor, and I would like to know what is the news you're getting out of these particular areas that are seeing the rise of cases from the doctors. But we are hearing that certain hospitals have to ration care, meaning they have to decide if a patient is worth getting, into their hospital, into treating. Can you explain what that process is like and how difficult could that be for those doctors?
So absolutely. It's not perfect world. And sometimes you have to make difficult choices when time occurs. I think rationing care is, I don't know if that's the right term, but again, being able to being able to decide for that particular patient what is best for him is up to both the patients, the families, as well as the physician involved in their care. Had we seen difficult times, earlier on? Yes, we did. Did we institute certain criteria? We did. And again, we had to be able to be providing care for everybody else. So I think having the notion that the physician is rationing care for any patient is a little rough to hear that. But again, I think we have to do the best for the patient that we think is appropriate.
Right. Truly a troublesome news. I can't imagine being a medical professional who has to make decisions because hospitals are just overwhelmed in certain parts of the nation. How are you looking at then vaccine mandates and mask mandates, doctors? And I'm going to ask you questions about children a little bit, but what is your take on these mandates and the importance of that? Healthcare systems are, making their employees get vaccinated. Other, offices are also looking to do the same. How are you looking at it?
So I think vaccine, I always come down to rather being a mandate. I think it's, you want to see yourself as why you as a person needs to get a vaccine. And if you can rationalize the reason as to why you are getting the vaccine and everybody is in the same boat, I think we'll be able to then have this vaccine herd immunity being present. We know that vaccines obviously decrease the rate of hospitalizations. We know that vaccines decrease the rate of severe disease. We know that vaccines help with the overall decrease in the number of asymptomatic carrier stage and passing it on. And therefore, vaccines definitely decrease the rate of transmission amongst the community. Now, on the flip side, we also know that the vaccine is safe. We do know that in these last, the last large 30,000+ patient population of subjects that we had with the trials, we know the efficacy of these particular vaccines have held up until now. There are certain criteria, for example, the myocarditis that came out. I think it is important to be able to say that, yes, it did come out, but the question is, if we didn't have the vaccines, what would be the rate of death, right? So I think it has held its up in its standards, and which is what is the most important thing. Safety comes first, right? So before you take anything in your body, you need to be sure that it is safe for you. So that safety parameter has still been upheld with all of these vaccines. Even with a third dose, it's doing relatively well with its efficacy as well as reactogenicity and the side effects that comes to it. So once you get the vaccine, I think preventing it from your loved one getting it, preventing it from somebody dying from it, preventing the disease causing death in your loved ones is probably the key in taking the vaccine yourself. And the more you think about it on an individual level as to why it's important, I think that will just portray out as to why it's important and mandated through and through, because it does definitely make a positive impact.
The Biden administration has been focusing on raising awareness for vaccines. They're trying to get more and more people vaccinated, doctor. But there are certain states where politicians are banning vaccine mandates or even mask mandates. What do you think is the role of government in all of this? And, what does it make you feel like when you hear somebody banning masks, something that's been helping us for the last year or so?
I think science needs to trump more than politics. And I think if science shows that it does work, I think that is a much more weighted statement rather than what the politicians say.
Yes, definitely. Doctor, now I would like to talk to you a little bit about the rise in children that we're seeing, the cases in children that's increasing. Many are relating it to the fact that schools are also opening up and, that could increase transmission. What is the safest way for schools to stay safe for all these children? What do you think should be the protocol in all the schools in this country right now?
So I don't know. But what should it be? What would I like my school to have is obviously everybody should have the social distancing and masking on. I think masking has really helped, not just COVID, but a lot of respiratory illnesses that would have normally been present. So we know that having a mask on, having a barrier, a physical barrier, does make a big impact in preventing one to the other transmissions. Washing hands and having Purell stations or hand wash stations at more visible locations, or reminding the students of doing so, I think is also important. Having the teachers and the educators and the adults in that community, in that school community, being vaccinated to both prevent themselves and keeping themselves safe as their educators, as well as preventing the possibility of transmitting as much as possible in a smaller knit area is going to be important. Once the kids reach the approved level of age where they are able to get the vaccines, trying to propagate that in the school system. The science behind that in the school system is also going to be very important. I totally believe in the fact that I don't think anything is mandated. I think it is recommended. And I think knowing why it is recommended is probably more important. The more knowledge you give, the more likely that other person in front of you is going to be able to adapt and hopefully assimilate the right data and do the right thing. So if everybody can keep their vaccines up, keeping the masking on, washing their hands, and having as much social distancing as possible is going to be helpful in the school district.
Definitely. I just have two more questions left here for you, Doctor. I would like to know your take on COVID-19 long haulers. We're hearing the community of long haulers is growing. There are many that are having effects after getting COVID, even months after that. Could you provide some information into that and, maybe advice for these people that may be long haulers?
So again, taking the COVID vaccine actually will decrease the risk of having the long haulers, right? You don't get the severe disease, so you're not going to be having that prolonged pulmonary or other neurological or physical derangements that you would have. So number one, prevention is the key, right? So if you can prevent the disease, hopefully you won't have this particular long hauler syndrome issues. So again, vaccine there too is remarkably helpful. Regarding long haulers, yes, we are seeing patients who have unfortunately been having a very prolonged morbid conditions that are occurring around. It's a relatively new disease. It's hard to really pinpoint exactly what the right treatment paradigms may be, but there are centers. I think all big hospitals really do have COVID recovery centers, which I would urge the patients who do fall into the long hauler system to be able to get as much information as there is, as well as help there is with the different faculties, be it neurology, be it pulmonary, be it psychiatry, be it internal medicine. Any of these faculty members who are able to help us with this particular symptomology is going to be important. And secondly, it is a brand new disease. It is something that science has not seen before. So again, coming to these centers does help in us kind of assimilating the data and being able to come to a decision down the road as to what is the best help for them and having the opportunities that they can get in that particular recovery area. So I think for all the long haulers, I would strongly recommend to seek out the local community, the local hospital area, which do supply the multidisciplinary approach for help.
Yes, I think that's a really important piece of information you gave. I think people should reach out to these recovery centers and areas, especially if it's near them. My last question to you, Doctor, I'd like to know your prediction for the next month or so. Where are you seeing the cases go in the north and in the south, east and west? I'd like for you to give our audience a little insight into what you think could be happening.
The number of cases as per the CDC and as per the Johns Hopkins COVID website, as we all see, is slightly a bit higher than what it was in the June, obviously, but it seems to be kind of plateauing, maybe a few ticks here and there up and down, but not as bad, thankfully, as what we were in the past, right? So thankfully, from that perspective, it's very, very, very manageable. So Northern Jersey, we're seeing a little bit more. Northeast areas, we're seeing a little bit more, but really not the alarming amount that we were seeing before. In the southern, where they're currently swamped, hopefully, we can just give them solace that, hey, you're pretty much at the peak at this point. It's just going to get better.
Yes, definitely. Well, thank you so much for your time today on ITV Gold, Doctor. I look forward to having you back again with us.
Thank you so much, Aditi. Thank you very much for everybody for hearing me.